Hello, Washington chiropractors. We find ourselves in strange times, and how we live, work, and interact with each other is changing on a daily basis. Governor Inslee issued a stay-at-home order on Monday, which takes effect today. Many of you are wondering what effect this will have on your practices, and I'd like to take a moment to explain exactly what that is. First and foremost, the governor's office has released a list of essential providers. Included on that list are physicians, which chiropractors are, as well as mid-level providers, such as massage therapists, and alternative healthcare providers, such as acupuncturists. All of these providers are allowed and encouraged to continue seeing patients. Some of you have patients asking why those providers are allowed to practice. The answer is simple: because they provide an important service to patients that cannot be received elsewhere, and those patients would otherwise overload the emergency facilities that necessarily need to focus on COVID-19 patients right now. Why such a wide variety of providers, though? Well, that's reflective of the value our state government places on access to health care, as well as its respect for patient choice. The WSCA's position has not changed during this emergency. We encourage all chiropractors who feel it is safe to do so to continue seeing patients. But we also recognize that not everyone will be able to remain open. There are countless variables that affect a provider's decision of whether or not to continue seeing patients. No two practices are the same. We respect the decisions you make in your own professional judgment, and the association will support you no matter what you decide. We ask that all chiropractors show the same respect for their colleagues' decisions. For those who choose to remain open, there are certain guidelines we've been asked to relay. Number 1, all chiropractors should be screening and cleaning. Screen every patient, make referrals when necessary, and clean all of your equipment in between each patient. Number 2, you should also be screening yourself and your staff several times a day. Check for fever and other COVID-19 symptoms. Anyone who is not feeling well or who is exhibiting any of these symptoms should not remain at work. Number 3, implement social distancing in your clinic. This means spacing out the seats in your waiting area at least 6 feet and only allowing one patient in the treatment area at a time. You may also consider asking your patients to stay in their vehicles until called. However, that is not a directive. And number 4, do everything you can to give your patients peace of mind. By that, I mean post signs in your clinic telling your patients what you're doing to keep them and your staff safe and healthy. Explain social distancing, the enhanced screening practices you'll be using, which patients will be prioritized over others, and the enhanced cleaning practices you're employing. It may even be a good idea to clean your equipment in front of your patients. It's a small gesture, but one that will reassure them. Another option to maintain continuity of care, whether or not you remain open, is telehealth. The CQAC recently met and passed a policy regarding chiropractors practicing telehealth. If you are treating or counseling patients remotely, you must be a Washington licensed chiropractor or hold a valid temporary practice permit. You can only remotely treat those patients with whom you have already established a face-to-face doctor-patient relationship. Telehealth practices will be held to the same standard as in-person chiropractic care. If you have questions about how to practice telehealth, the WSCA is in the process of developing a webinar to explain everything you need to know. Keep in mind that chiropractic care is just as important now as it always is. Treating urgent musculoskeletal conditions may be the priority, but it's not the only condition that chiropractic can help right now. Patients with metabolic disease, cardiovascular conditions, anxiety, and depression may have increased morbidity now that their access to parks, gyms, and social interaction has been heavily curtailed. Emotional stressors, like fears about their health or their ability to make a living, will also have a great impact on their overall health. Chiropractors have an important public health role to play in watching for those conditions and connecting patients with both the healthcare and social services that they need to stay well, both physically and emotionally. And much of this role can be accomplished remotely. Some of these services may be reimbursable, but even if they aren't, maintaining that continuity of care will not go unnoticed by your patients. or by state health officials. This is no doubt a dark time for our communities, and none of us know when they're going to take a turn for the better. However, it's also a great time for chiropractic to shine. You went into this profession because you believe in safe, drugless care options. The circumstances we face and the tools available to you today have never been better to connect your patients with your essential services. Keep watching our emails and newsletters. And if you're a licensed chiropractor, join the private Facebook group listed below to make sure that you get all of the latest information from the WSCA. Rest assured, if anything changes or if there are any new developments, the WSCA will let you know as soon as possible. We're in this situation together, and together we'll get through it. Observe the recommended precautions. Limit your time outside your home and workplace. And remember to stay positive. Now, more than ever, the WSCA is committed to helping all chiropractors help patients.